A man in his 60s slowly began to lose the ability to walk. At first, it was subtle. His legs felt weak when getting up from a chair. Then climbing stairs became difficult. Then weakness gradually progressed, affecting more of his daily movement. Eventually, even standing up felt exhausting. Over the following months, a man who once walked independently and exercised moderately ended up confined to a wheelchair for the rest of his life. But what made this case truly terrifying was that the cause was hiding inside a medication taken by more than 90 million Americans and over 1 billion people worldwide. A medication so common that millions swallows it every single night before bed without even thinking twice. A statin, specifically Atorvastatin, which you might know by its brand name Lipitor. Statins are considered some of the most important medications in the modern medicine. Atorvastatin and its close cousin rosuvastatin are among the most widely prescribed medication in the world. They lower cholesterol, reduce the risk of heart attacks and strokes, and according to many experts, save countless lives every year. But those claims have become increasingly controversial, and we discussed why in another video in the channel. If you are interested, you can check that out afterward. But despite their claimed benefits, statin can also cause side effects. Nausea, vomiting, fatigue, weakness, and muscle pains are relatively common complaints among statins users. And in extremely rare cases, statins can trigger a serious and sometimes life-threatening condition known as necrotizing myopathy. Necrotizing refers to cell death, myo means muscles, and pathy means disease or damage. So, necrotizing myopathy means muscle damage caused by muscle cell death. When necrotizing myopathy happens, muscle cells, most commonly in the thighs or arms, begin to break down and die. This process weakens the muscles, making movement difficult and sometimes even impossible. But the danger does not stay limited to the muscle themselves. As these muscle cells break apart, they release large amounts of substances into the bloodstream that are normally harmless and essential when they kept inside the muscle cells. But once they're released into the bloodstream, some of those substances can become highly toxic, especially to the kidneys and heart. For example, myoglobin is a protein that normally helps muscles to store oxygen and function properly. But when massive amount of myoglobin enters the bloodstream, it can severely damage the kidney and even cause kidney failure and death. The same is true for phosphate and several other substances released from dying muscle cells. And then there is potassium. Potassium is essential for normal cells and heart function, but when muscle cells suddenly rupture, they can release dangerously high amount of potassium into the bloodstream. This condition called hyperkalemia can disrupt the electrical activity of the heart and cause it to stop completely. And you may have seen scenes in movies where someone is executed using an injection to stop the heart. In those scenes, one of the chemicals commonly used is potassium, which disrupts the heart's electrical signals and can cause the heart to stop beating. We put a lot of time and effort into scripting, recording, and editing these videos, but our channel is still pretty small. If this type of content helps you even a little, give that like button a gentle hit and subscribe. It really helps us. Thank you. But in necrotizing myopathy, the body is essentially releasing its own potassium into the bloodstream from the damaged muscle cells. And in severe cases, that alone can stop the heart from beating and can be fatal. And that man has been taking high-dose atorvastatin daily for years to treat his hyperlipidemia or abnormally high levels of fat like cholesterol or triglyceride in the bloodstream. And more recently, his medication has been switched to another statin called rosuvastatin. But that was only part of the story. He also suffered from multiple other medical conditions including diabetes, hypertension, chronic kidney disease, and abnormal heart rhythm, and diverticulitis, or inflammation of small pouches called diverticula that can form in the wall of the colon. Along with his statin, he was also taking several other medications including gemfibrozil, another lipid-lowering drug known to increase the risk of statin-related muscle damage when combined with statin. At first, his symptoms did not seem dramatic. Many people on statins complain of muscle aches, soreness, weakness, and so on and so forth. But this man's case was different. He did not complain of pain, he complained of weakness. Not just general tiredness, his proximal muscles, which are the closest muscle to the center of the body, were severely weak. His hips were weak, his shoulders were weak, standing up became difficult, and lifting his arm became exhausting. But strangely, the muscles farther away from the center of the body, like his hand and feet, remained relatively strong. And that pattern matters, because certain diseases attack muscles in a very specific way, and this pattern immediately raised concern for a serious muscle disorder. Doctors ordered blood tests immediately, and the results were not good. Multiple abnormalities pointing towards severe ongoing muscle destruction. His creatine kinase levels were massively elevated, a major warning sign that muscle tissue was actively breaking down inside his body. His AST and ALT levels were also elevated. These enzymes are commonly associated with liver injury, but they can also leak out from injured muscle cells. His BUN and creatinine levels were high as well, showing that his kidney were struggling to clear waste product from the bloodstream. And then there was myoglobin in his urine, something that should not normally be there at all. That finding was especially dangerous. It meant damaged muscles protein were flooding in the bloodstream and reaching the kidney. Doctors then ordered an MRI of his thigh muscles, and the imaging confirmed it. Necrotizing myopathy. But muscle weakness doesn't always mean that the statin is responsible, even if the patient happens to be taking one. There could be many other possible explanations for his muscle weakness. It could be a thyroid problem. Both hyperthyroidism and hypothyroidism can cause muscle weakness. And low thyroid hormone levels in particular are well known to cause fatigue and muscle dysfunction. It could have been polymyositis and dermatomyositis, autoimmune diseases in which the body's own immune system attacked the muscle cells. Or it could have been cancer-related muscle disease. Sometimes cancer located far away from the muscles can release substances that trigger weakness and inflammation throughout the body, a phenomenon known as paraneoplastic syndrome. So, doctor began searching for the answer. His thyroid function was normal, which rules out thyroid problems. The autoimmune panel came back unremarkable, which rules out autoimmune diseases like polymyositis and dermatomyositis. Cancer screening was done, paraneoplastic antibodies were checked. Everything kept coming negative, negative, and negative. But then one test returned positive, extremely positive. Anti-HMGCR reductase antibody, and that changed everything. Normally, the immune system attacks things it recognizes as foreign, like bacteria, viruses, transplanted organs, and other threats. Statins work by binding to an enzyme called HMGCR reductase, which plays a major role in cholesterol production. When statins bind to these enzymes, they slightly change its structure, and that change helps block cholesterol production, but in extremely rare cases, the immune system mistakenly sees that altered enzyme as foreign and begins producing antibodies against it. Those antibodies eventually attack muscle cells and destroy muscle tissue, like in this case. Doctors finally have their diagnosis: statin-induced necrotizing autoimmune myositis, or SINAM. A condition so rare that only 1 to 4 people per 100,000 statin users develop. It can happen at almost any dose and at almost any time during the statin therapy, but higher doses appear to increase the risk significantly. Most reported cases occur with high-dose statin therapy of 40 mg or 80 mg. And there is what makes this disease especially dangerous. Normally, if statins cause common side effects like muscle pain, soreness, or fatigue, stopping the medication usually fixes the problem. But SINAM is different, because statin itself is no longer directly damaging the muscles, but it is the immune system that destroys the muscle cells. And once the immune attack begins, it can continue even after the drug is stopped, like a fire that keeps burning long after the spark is gone. Doctors immediately discontinued the statin and started aggressive treatment with high-dose prednisolone, methotrexate, and powerful immunosuppressive medication designed to stop immune system from attacking muscle cells. At first, there was some improvement. His creatine kinase level dropped from 6,000 to around 500, which indicates that muscle breakdown is slowing down. But clinically, he still could not walk, his muscles were still failing, and he remained unable to function independently. So doctors decided to escalate treatment. But this next step carries a serious risk. They consider IVIG, or intravenous immunoglobulin treatment, a treatment that can sometimes calm severe autoimmune disease. However, IVIG can also increase the risk of blood clots. And this patient already had a history of deep vein thrombosis or DVT, pulmonary embolism, cardiac arrhythmia, and multiple cardiovascular risk factors. Adding a medication that increases the clotting risk could potentially trigger a stroke, heart attack, or another life-threatening collapse. But without strong treatment, he might never fully recover. So doctors proceeded carefully. IVIG was administered slowly over days along with steroids and other immunosuppressive medication, designed to partially suppress his immune system and prevent further destruction of muscle tissue and HMG-CoA reductase enzyme. But despite aggressive treatment, his condition continued to worsen. On the 7th day of the admission, he developed acute encephalopathy, a broad medical term that simply means the brain is no longer functioning properly. In simple terms, the patients became confused, disoriented, mentally slowed, and less responsive. He have struggled thinking clearly, recognize people, or stay fully awake because his brain is not functioning properly. But why did this happen? Because his kidneys were beginning to fail. Normally, the kidneys filter nitrogen-containing products, including substances like urea and creatinine. But when the kidneys shut down, these waste products begin building up inside the bloodstream. Eventually, those waste products can reach the brain and interfere with normal brain function, causing toxic metabolic encephalopathy, a form of brain dysfunction caused by buildup of toxin that the body can no longer clear properly. Doctor connected him to a dialysis machine in an attempt to remove toxin and prevent further damage, but nothing worked. An electromyography or EMG was also performed, which showed extensive muscle injury in his thigh, a very concerning sign suggesting significant ongoing muscle breakdown. And unfortunately, the patient continued to deteriorate. Over time, he developed severe depression, and eventually doctors declined further aggressive treatment. On day 19th of hospitalization, care was transitioned toward comfort-focused treatment, meaning the medical team stopped trying to cure the underlying disease and instead focusing on relieving pain, distress, and ensuring the patient was as comfortable as possible. He remained confined to the wheelchair for the rest of his life. Now let's zoom out for a moment. Statins remain one of the most widely used medications in modern medicine. They are prescribed to prevent primary, secondary, and tertiary cardiovascular disease, and for most people, they provide some life-saving benefits. And we have discussed how effective is it and the controversy around statins in another video on the channel. You can check that out afterward to have a better understanding of the medication. But in rare cases, statin can trigger severe muscle injury, including rhabdomyolysis and autoimmune necrotizing myopathy. And once severe muscle necrosis occurs, some of that damage may never fully recover. That's what makes the side effects so important, because the early symptom can appear deceptively mild. A little weakness, trouble standing up, difficulty climbing stairs, and other symptoms many people might ignore or simply blame on age. But hidden underneath, deep inside the body, the immune system may destroy muscle fibers day after day. As muscle cells break down, they release dangerous substances into the bloodstream that can shut down the kidneys, disrupt the heart's electrical system, and potentially become fatal. This condition appears to be more common in older adults, people with kidney disease, people taking high-dose statins, and people taking medication that interact with statins. One especially important drug is gemfibrozil, another lipid-lowering medication that has been shown to significantly increase the risk of severe statin-related muscle injury. Taking gemfibrozil together with statin is considered a major risk factor. And the earlier doctors recognize the condition, the better chance of preserving muscle function and prevent permanent disability. But statins themselves are not bad medications. For most people, they are beneficial drugs that reduce the risk of heart attack, stroke, and cardiovascular death. But medicine is rarely black and white. Even medication that claim to save millions of lives every year can trigger devastating disease in rare individuals. And SINAM is one of the clearest examples of that reality. A disease where the body mistakes its own muscles for an enemy and keeps attacking them long after the original trigger is gone. And if you want to learn more about atorvastatin and other statins, including the benefits, risks, side effects, and controversies, we have covered all of that in another video, which is here. If you are interested, check this video out. I will guarantee it will worth your time.